Hi, I'm Dr. Amy Waterman, the creator of Explore Transplant.
And I'm Dr. Irvin Ruzix. I've been a kidney transplant surgeon since 1989.
I'm so pleased that you're taking the time to learn about transplant as a treatment option because you are an expert in your own life. This program will help you learn whether transplant is right for you.
What's most important is that you make an informed decision. These videos were designed to help you do just that.
You might have questions such as, what is a kidney transplant and why should I even consider one?
Or, is staying on dialysis better for me?
I would want to know, what are the risks and benefits of transplant and living donation?
These 4 videos will answer those questions and more. You should watch these with people who help you make important health decisions, your close friends or family members. We'll join you afterwards to talk more.
So please join us as we explore transplant.
It makes you feel good as a person, knowing that you helped someone. That's how I feel. I feel great in doing it. It made me feel very good in doing it. Like I said, I would do it again.
The gift I got from this whole process is life. Having life and being able to live it with no limits.
This video has offered you a lot of different options.
And every patient is different. You are the only one who knows what is right for you. Which of the actions in this brochure, deciding what to do, would you be willing to take?
For example, patients could choose to learn more about transplant or about how to make dialysis work better for them. They could also decide to start transplant evaluation or consider living donation.
What would be the first step you would take? When would you start? Are there barriers you might face? If so, you should talk to people who care about you to think about how to keep moving forward.
We recommend that you tell your doctor and dialysis team what steps you want to take so they can support you. Your family and friends need to know too.
Congratulations on finishing the Explore Transplant video series. Thank you so much for taking the time to make an informed treatment choice.
We wish you good luck.
And good health.
There are 2 ways of doing surgery to remove your kidney. One is an open technique, and what we do is we make an incision in your back here about 10 centimeters long, just enough to remove your kidney. Now another method is to do it what we call a hand-assisted laparoscopy, wherein we make a few small holes in the front and remove the kidney, and at a time when the kidney is removed from your body, we'll make a small incision down in the pelvic area about this much, again just enough to take out the kidney, and that scar usually is hidden if you were to wear a bikini.
Okay, so the scar is not obvious. Yeah, it can be hidden if yeah.
That's right.
I wear the.
The reasons to have a kidney transplant are you're going to feel better, you're going to be able to drink more fluids, you can travel, you don't need dialysis, and you're going to live longer. You can have a kidney from a person who's living, a living donor. That living donor can be your relative, can be your boyfriend, can be a church member, can be your cousin. There's so many people who can donate a kidney to you when they're still living. There's also a deceased donor. A deceased donor kidney comes from a person who's passed away and has donated the organs for transplantation. So I wanted to make sure that you call a transplant center and be evaluated.
I appreciate dialysis, but what is the next step? Dialysis is still not allowing me to live the life that I want to live, and I want to go back to as close as that normal life I was living. So I wanted to know what were my options. And when I found out transplant was the closest thing to a cure and feeling as best as I can the way I used to feel prior to dialysis. Let's do it. Sign me up.
I have a sick loved one, and there's a solution for it, and the best possible treatment was, to be a living donor, and that's basically all I thought about. I never thought about anything in between, and I was eager and anxious. I was the one that I felt got the ball rolling. I got people, I said I was the donor, and I wanted to I wanted to do it now. I wanted answers. I wanted to know, why can't we do this? He's on dialysis. He doesn't need to be on it, and I'm going to be his donor.
Transplant has been able to give me the opportunity to coach my son's baseball team. If I was on dialysis, I mean, be lucky to get to first base, if that. I mean, now I can, on the ball field, keep up with my son, actually. I can run the base. I could run, from home to home, I mean, just like I used to be able to.
I've just always known if there's something you can do to help another person, and it's not hurting you in any way, then there's no reason that I wouldn't do it. And especially if it means saving somebody's life. And to have this opportunity to help Yvonne, I kind of always thought I would be a donor, but I would be gone and wouldn't really know about it, and it would go to a stranger, and that was okay too. But to be able to help somebody that I know and that I care about, just is a gift to me too.
The gift I got from this whole process is life. Having life and being able to live it with no limits.
I had a pain in my stomach. I went to the hospital. That's what they told me, that I was about to get on dialysis. When they told me dialysis, I had no clue about what dialysis was all about. So that's when the whole journey started. When I decided that I wanted to have a transplant, I called a transplant center, and that's how I started getting enrolled. The transplant center took my call, and that's how I started my evaluation. There's ways to get the medicines. You can get it through your medical or Medicare, or once you start feeling better, you get a job, and then you start working for insurance, and then you'll get your medications through that. Look into transplantation as an option, and ask people. Don't listen to the bad stories, because not everybody is the same. What might be good for you, it might not be good for someone else. But there is a big thing though, that you are in charge and you're responsible for your health. So the more you learn, the more you educate yourself, the better you're gonna do.
Hi Francisco, my name is Martha. I'm your financial coordinator. Anything to do with insurance issues is me you're going to contact.
I'm a little concerned about the cost of the transplant. What can you tell me?
We have all the details of your transplant benefits here. We're going to review all of your out-of-pocket costs because there's a lot more costs involved than just what your insurance is going to cover. I have here a list of all the medications that you could possibly be on. I'm not sure which ones you're going to be on or not, but at least you'll have some idea. We're going to review what your insurance covers and doesn't cover. And then if you find that maybe these copays are too large or you're having any issues, you should be contacting us. We have a lot of resources that we can tap into to help patients pay for those copays. There's just so much help out there, and we can't help you unless you let us know you need help.
So the day after Thanksgiving, I went back to the hospital, and the doctors told me, you have end-stage renal disease. Your kidneys have totally shut down. You have less than 10% function in both your kidneys. And you're going to have to go through the process of getting a transplant or going on dialysis. The doctors told me it looked like your kidney has run its course. Even though we was able to control the virus, you had it for 10 years, you're going to have to get you replaced on the list. You're going to need another transplant. I'm going to do it again. I'm going to do it again. I'm going to go through the process. I'm on dialysis now. I'm on the list. And I'm still living my life.
I talked to my mom, my father, and my sister that I was going to need a kidney. And my sister offered. She said, I'll try it out, see if I could donate.
His sister looks like she was gonna do it, but I said, let me try it. It never hurts to try. So I did, and it turned out to be that I was a match. They put in a camera through here. I'm not sure what's the name of it. It's like a little camera to guide them. And that was it. That's all they did. They took out my left side, my left kidney, and it was quick.
We're 13 brothers and sisters. Grandkids, my dad has, I'll say, approximately 60 or 70 grandkids.
His life has changed so much since this, and he's very, very happy. And they see us happy, so gets them happy as well.
What I'm gonna grill is steaks, hamburgers, carne asada. For the first time, guys, it will be the first time I jump in a pool since I had the transplant.
I would see him and I would say, I'm so happy that he's finally, have his kidney and he gets to move forward.